But that was a great introduction to it, and it really kind of piqued my interest in it. We actually now, and over the last 3 or 4 years, have been treating these patients with a medication usually used to treat high blood pressure called propranolol, so that now these category of medications called beta blockers seem to slow the growth of these blood vessels gone astray. So between the beta blockers and prednisone, judicious use of surgery, perhaps even laser applications, we can really make a big difference, especially for those that are on the face or in areas of central functional cosmetic importance.
When you do surgery as a surgeon, you know, probably a lot of your training is in adults initially.
Correct.
And then to change your mode of thinking in your delicate hands to a small child or a baby. How do you do that delicate work?
I think it has to do with what appeals to you as well. I think that there is some times, especially in surgery, everyone thinks of surgery as always being very precise, but sometimes some of the things really, big operations done on adults have to be done fairly rigorously. I've always been kind of drawn to the precision, the meticulousness, and the attention to detail.
I believe that. I believe that fully.
Attention to detail that a baby requires. But I also think it's like anything else. It's the, you get good at what you do and you get used to it, and I know that people marvel at the ability to operate on a 600-gram baby in the same way that I marvel at their ability to do these liver transplantations on adult patients. So I think it's having the focus. I think it's practice. I think it's practice with good teachers that generates expertise. And I've really, for the last 25 to 30 years of my life, dedicated myself to that art.
Great, great. Dr. Cullen, summer is a special time of year where children are out of school, they can like to be outside and play, families can get together, and although the intent is for fun and family enjoyment, sometimes that's when some of the most serious things may happen. And it's a good time to, I think, talk about prevention of injuries that may lead a patient to see you. And I'm sure you have a lot of valuable information that you can relate to our viewers in terms of what are the most common injuries that you see and how do they occur and how can they be prevented?
Well, clearly the only thing that I've heard for the last week is when school is going to end. I could tell you to the hour, the minute, and the day because my daughter reminds me. So yes, school is coming to an end, and it really now is their children are home, and they really have looked forward to this escape, this time of relaxation and rejuvenation and recharging. And the most important thing that happens around this time is that even in Michigan, the weather does get warm. We do have
eventually.
We do have a sunny day, and people open their pools. And one of the biggest tragedies and the most 100% preventable tragedy is drowning. And every year at this time, that early enthusiasm for the opening of the pool, that there's inattention and a child will go into the water and drown. And everyone believes that this is an event that's heralded by a splash, a scream, that there's going to be some warning and some time to respond. But it really is a silent disappearance of that child from sight. Fences are mandated, fences with locks are mandated by law in terms of regulation, but there's no substitute for eye contact supervision. If you have children around a pool, someone needs to be responsible for knowing each and every one of them and where they are. And adults who have pools in their home need to have a phone by the pool. And I really think it would be good for them to know how to do CPR should something like that happen.
And I would also think if it's more than just the parent and the child, or sometimes even it can be as simple as that, that the more people that are there, the more likely distractions are able to occur. You know, you get involved in a conversation, it doesn't really take that long, does it?
It does not take long. It's just minutes. And it really is, as I said, 100% preventable. And I think that there's a belief that life preservers, swimming instructions are things that will prevent this from happening, and that really is not a reliable way to prevent it. And you're right, David. The occasion of celebration is a pool party that usually is accompanied by the second thing that happens, which is barbecuing. People will have out their grill, perhaps a campfire, a fire pit, and someone needs to be responsible in that instance for creating a no zone, a demilitarized zone around the grill, around the campfire that the kids are not allowed to run and play.
Especially if it's a fire pit that's low to the ground, it's
Correct.
not an elevated grill.
Correct. People can run, they can trip, they can fall in and sustain serious burns to their hands, they can fall backwards, serious burns to their back or their buttocks. And then what do you do at the end? If everyone's cleaning up, that's the hard job, no one wants it. And then they have the coals from the charcoal grill to dispose of. People have gotten the idea that taking them and placing them on the ground or burying them underneath the sand will extinguish the coals, but it really doesn't. That sand acts almost like an oven to insulate those coals. And the next day, the temperatures can be as high as 300 and 400 degrees.
Amazing. I didn't know that.
And then children are running through the park. They don't see it because the coals are buried under leaves or sand, and then they're barefoot, and they sustain serious burns to their feet as well. And every year, there's a half dozen children who are admitted to the hospital with burns from stepping on coals that were presumed to have been extinguished. So the solution is to either use those containers that are provided at the park to dispense with them, or to take water and a stick and stir the coals until they're completely extinguished. You have to do the final little bit to make sure that
I remember they used to have commercials on television to show us how to do that. I haven't seen them
soak
lately.
and stir. Yeah, that's it. That's it.
Anything you would have to say about sun safety?
Well, I'm talking to the choir, talking to sun safety to a dermatologist. You know, everyone wants children to sunscreen. The choir's listening. And again, it's this enthusiasm for the first warm day. People are out, and maybe you're at Belle Isle for a picnic or out at Metro Beach. Young children especially have to be protected from the sun. They need hats, they need shade, and they need sunscreens. I always tell my patients, and especially with my work with burn patients, that their skin has been injured, and they're much more sun sensitive because they've had some permanent pigmentation loss. So for them, it's a sunscreen with an SPF of 15 or above that needs to be applied and reapplied.
For our viewers, just for example, you realistically see probably more severe burns than I do, and
Sure.
Frequently. What is somebody who's gotten too much sun, what is the potential for them to look like, and what sort of problems may they develop?
Well, a sunburn is usually a first-degree burn, and where it's just the superficial layer of the epidermis of your skin. There's redness, there's pain, there's discomfort. But for a child, a burn covering 15% of the body can make them sick. It can give them fever, chills. They can become nauseated. Many of them require hospitalization just for pain control and giving them IV fluids to avoid dehydration. So while what would be something for you, an inconvenience, perhaps some blisters and a sore back and discomfort you could handle with a little ice and some Tylenol, for a baby or for a young infant, this is a condition that could require hospitalization. So we have to be very, very cautious. It's very, very easy for it to happen. Even with light clothing, the sun can penetrate. And so that they really do need, before they go out, the application of the sunscreen, and then attention to its reapplication if they've been swimming. Hats and shade is another important thing for little children if they're going to be out.
A lot of times I think a parent may logically think, oh, a t-shirt is sun protection, but some t-shirts may have an SPF factor of about 2.
Correct. They're very porous, and they can allow those injuries.
You hear every once in a while the term sun poisoning. Can you take that lay term and tell us what that means?
I wish I could, David. Sun poisoning is going to be new to me. It may be the systemic
effect.
syndrome
Yes,
of both the hyperthermia associated with the outdoor exposure as well as the damage to their skin.
What about fireworks?
Oh, I'm so glad you asked. Now I can get up on my pulpit. It's really amazing. I mean, the 4th of July is, of course, a great celebration. In fact, I had a patient in the office the other day who I asked him how old he was, and he went to tell me. He said, but I'm going to be 10 on Independence Day. So Independence Day is around the corner, and in fact, we have the banners coming into the memorial today to indicate that that holiday is approaching. In Michigan, anything that flies or makes a loud explosion is illegal. And I know that people can purchase these things out of state, but in the state of Michigan, these are illegal, and this includes cherry bombs, M80s, Roman candles, bottle rockets. All of those things are illegal. Which says there's almost nothing that is legal. Well, I think there are some, but I mean, clearly the best thing to do is to attend a sponsored firework in your community, which is safer.
And children, especially, I think, are very fascinated by that. The thought of lighting something, seeing it sparkle, shoot off,
It
fires.
absolutely is. It is really an attractive nuisance. But
I guess I'm speaking from personal experience. When I was that age, it is, you know, I think a universal thing
it's
almost.
a moth to the flame. People are drawn to it. But it has to be done with careful supervision. And what has happened is sometimes a firework has been partially lit or discarded. A child will pick it up and try to ignite it again and have it explode in their hand. You have loss of fingers, you have injuries to their eyes or their face. I had a child in the burn unit, and this is almost incredible to believe, but he had a package of salutes that he had started to light when his mother walked into the kitchen. And he took them and placed them in his back pocket.
Oh my gosh.
Only to have a burn on his behind that he's going to remember for the rest of his life. But in his desperation to cover up his misdeeds, he put it in his pocket and was burned by it. Again, families should really attend sponsored fireworks. The home or backyard fireworks need to be done with careful supervision. These devices are somewhat unpredictable. The matches used to light them need to be supervised because kids really just, despite their interest, they're not at a cognitive level to appreciate the safety risk. Even sparklers, which are fun and kids run around with them, the tip can generate temperatures of about 2,000 degrees.
Wow, I didn't know that.
Yeah, you can have a burn to your eye, burn to your face, or when they're discarded, someone can step on them and burn their feet. Half of all the firework injuries are in children under 5 years of age. So you'd think that it's teenagers who are doing it, but it's the little kids who are being injured by it.
What about bicycling, skateboarding, probably more appropriately skateboarding for kids?
Skateboarding. Well, I think that any wheeled...
Rollerblading.
Yeah, any wheeled conveyance like that. Rollerblades and skateboards and bicycles all have you going faster than normal. And the real risk is head injury, that if you fall, you'll injure your head. And again, there's a very, very good prevention model, which is a bike helmet. And if anyone's ever seen a child in the hospital who's had a concussion or a head injury, they'll know that the serious consequences of a bicycle-related injury is closed head injury. It's responsible for 2/3 of the deaths that result from bike accidents in kids.
Really?
Yeah.
That's an alarming statistic.
It really is. And this is where, as adults, we really have gotten the message about car seats. We've really gotten the message about seat belts. But you can walk out on Lakeshore Drive with me, David, and see adults riding up and down. They're not wearing a bike helmet. So what we really want people to do is set a good example. If you're riding with your kids,
adults are the role models.
Absolutely.
You know, I think adults naturally want to protect their children,
right.
and do the best for them always. But sometimes, you know, the child just sees what mom and dad are doing or whatever, or their friends, and so that they want to mimic that.
It is exactly the
or
case.
It looks strange. Why do I have to be the only one with a bike
helmet? It doesn't look cool. But
right,
think how not cool you'd look if your head is wrapped up in a bandage, like the mummy.
And you know, sometimes people who are active in sports are more likely to get concussions as well. You know, playing baseball and football and all those sorts of things.
And in those athletic competitions, there's mandatory wearing of headgear. The pros wear them. The pros wear hockey helmets now, which they didn't used to. The baseball players all do, as well as football players. So,
one thing I want to do, Dr. Cullen, before we wind down, you know, I could see potential for many people wanting to see you for various reasons, or to for consultations, or to see you for your expertise. How would somebody get in contact with you?
Well, it's very, very easy at the hospital. We have an office that's in the professional building that's attached to the hospital right on the second floor. It's very child-centric and very family-friendly.
This is your emergency room.
You know, I don't think you want to go there, but it's just like everything else. It's nice to have it when you need it. People can reach the office by calling the number I think that you'll show on the screen, which is 343-3978. St. John has a website that if you link to the pediatric surgery link, it gives our biographies, our availability, our areas of expertise of all the pediatric surgical specialists that provide care at St. John.
Well, Dr. Cullen, it's been a fast 30 minutes, and thank you so much
absolutely
for coming on to be on A Heartbeat.
Thank you for
We appreciate you coming out. And to our viewers, thank you so much for tuning in as well. Take good care of yourself and those around you, and have a great day.